Have you ever found yourself sitting on the edge of your bed in the morning, not moving, just breathing for a moment before you even try to stand? You haven't taken a single step yet, but somehow you already know exactly what is about to happen. That first step is going to hurt. Your knees will feel stiff, heavy, almost like they don't belong to you anymore. And sometimes, before your feet even fully touch the ground, you can already hear it. That quiet grinding sound, that subtle crack or pop that wasn't there years ago. It's strange, isn't it? Just a few hours ago, you were lying down, completely still, resting, doing nothing at all. And yet somehow, overnight, your body feels older, slower, less reliable. So let me ask you something. Why does this happen? Why can a single night of sleep make your knees feel like they've aged 10 years by morning? Most people will tell you it's just part of getting older, but what I'm about to show you is that the real reason is something almost no one ever explains. And once you understand it, you will never stand up the same way again. Here is where most people make a very dangerous assumption. They feel that stiffness, that pain, that hesitation in their knees every morning, and they tell themselves something that sounds harmless. This is normal. I'm getting older. This is just how it is now. And that one belief is where the real problem begins. Because what you are feeling in those first few steps of the day is not just aging. It is a signal, a very specific signal, that something inside your joint is not functioning the way it should. The stiffness you feel is not random. The discomfort is not meaningless. And that grinding sensation, that subtle crunch or click, that is not something your body was designed to accept as normal. What most people don't realize is that those painful first steps in the morning are often the very beginning of a much deeper process. A process that, if repeated day after day, slowly wears down the structures inside your knee. Not dramatically, not all at once, but quietly, gradually, almost invisibly. Because here is the part that keeps many of my patients awake at night once they understand it. The damage is not happening when you are walking. It is not happening when you are active. It is happening in those first few moments, when your joint is at its most vulnerable, when everything inside your knee is not ready yet, but you force it to carry your full body weight anyway. And when you repeat that every single morning, week after week, month after month, year after year. Knee pain. You are training your joint to break down faster. That is the difference. And the most unsettling part is this. Almost no one warns you about it. Because from the outside, it looks harmless. It looks like a normal morning routine. Getting out of bed, standing up, walking to the bathroom, nothing extreme, nothing dramatic. But inside your knee, in those exact moments, that is where the real stress begins. And if you don't understand what is happening there, you will keep repeating the same mistake every single day. I want to tell you something honestly, not just as a professional, but as someone who has spent years watching this happen to real people. Over the past 2 decades, I have worked with hundreds of patients over the age of 60 who came to me with the exact same complaint. They would sit down across from me and say, "Doctor, my knees are fine during the day, but in the morning, they feel stiff, painful, almost locked." And almost every single time, they believed the same thing. They believed it was just aging. They believed it was something they had no control over. But what surprised me the most was not the pain itself. It was the pattern. Because when I started paying closer attention, I noticed something that almost no one talks about. Nearly all of them were making the same small mistake every single morning. Not once in a while, not occasionally, but every day, without even realizing it. And that mistake had nothing to do with what they ate, nothing to do with how much they exercised, nothing to do with medication. It came down to something much simpler: the way they were standing up, the way they were loading their joints at the worst possible moment. And when I began teaching them how to change that, something remarkable started to happen. Not overnight, not instantly, but within days, They started to notice a difference. Within weeks, many of them reported less stiffness, less pain, more confidence in their movement. And the most powerful part of all? We didn't change their age. We didn't fix their joints. We simply changed what happened in the first minute of their day. That was it. And that is exactly what I am going to show you next. Here is the part that most people never hear, and it changes the way you think about knee pain completely. Your knees are not failing because you are getting older. They are struggling because of when you are using them. Let me explain. Most people believe their knees hurt because they walked too much, stood too long, or put too much stress on their joints during the day. But in reality, your knee is strongest when it is warm, when it is moving, when everything inside the joint is already active and ready. That is not when the problem happens. The problem happens at the exact opposite moment, when your knee is cold, when it has not moved for hours, when the muscles around it are still inactive, when the fluid inside the joint is not ready to protect it yet. And in that exact moment, you ask it to carry your entire body weight. All at once, no preparation, no transition, no warning. It is like starting a car engine in freezing weather and immediately flooring the gas pedal. Not letting it warm up, not giving it time to circulate oil, just forcing it to perform under maximum load instantly. And then repeating that every single morning. So the real question is not, why do my knees hurt? The real question is, why am I putting the most stress on my knees at the exact moment they are least prepared to handle it? So what exactly is happening inside your knee while you sleep? Because this is the part that changes everything. There are 3 quiet shifts that happen overnight, and almost no one is aware of them. The first one involves the fluid inside your joint. Your knee is not just bone and cartilage, it is a living system, and inside that system is a special lubricant called synovial fluid. Its job is simple, but critical. It reduces friction. It allows your joint surfaces to glide smoothly over each other. It protects the delicate cartilage from wear and tear. But here is what happens after you lie still for 7 or 8 hours. That fluid becomes thicker, slower, less responsive, almost like a jar of honey that has been sitting in a cold room overnight. It is still there, but it is no longer ready to do its job instantly. Now, the second shift happens in your muscles. The large muscle at the front of your thigh, your quadriceps, plays a major role in protecting your knee. When it is active, it acts like a natural brace. It stabilizes the joint. It absorbs part of the load when you stand or move. But during sleep, this muscle essentially switches off. Not permanently, but temporarily. When you wake up, it is not fully engaged yet, which means your knee is suddenly carrying more stress, with less support. And then there is the third factor, the one most people never think about, your cartilage. Unlike muscle, cartilage does not have its own blood supply. It relies almost entirely on movement, and that synovial fluid to stay nourished and healthy. When you are still for hours, that system slows down. Hydration decreases. Protection decreases. So when you wake up, your knee is not just stiff. It is less lubricated, less supported, and less protected, all at the same time. And then, in that exact state, you stand up. You place your full body weight onto a joint that has not been prepared yet. That is the moment everything changes, not dramatically, not all at once, but enough to create friction, enough to create pressure, enough to start the cycle that leads to pain. And if you repeat that moment every single morning, your knee never truly gets the chance to recover. Now let's slow this down for a moment and really understand what is happening on a deeper level, because once you see the mechanism clearly, the pain starts to make sense, and more importantly, the solution becomes obvious. When your body is awake and moving during the day, your joints are constantly being maintained in the background. Every step you take, every time you bend your knee, something important happens inside the joint. The synovial fluid is being circulated. It is being pushed and pulled across the surfaces of your cartilage. Think of it like a thin layer of oil spreading evenly across moving parts in a machine. That movement keeps everything smooth. It keeps everything protected. At the same time, your muscles are active. Your nervous system is sending signals continuously. Your quadriceps are adjusting, tightening, relaxing, stabilizing your knee with every step. Even your cartilage benefits from this, because while it does not have its own blood supply, it relies on this cycle of compression and release to absorb nutrients. Movement is not just motion, movement is nourishment. Now compare that to what happens when you sleep. For 6, 7, sometimes 8 hours, your body is almost completely still. There is no joint movement. There is no mechanical stimulation. The circulation inside the joint slows down dramatically. The synovial fluid, instead of being evenly distributed, begins to settle. Its viscosity increases slightly as temperature drops and movement stops. It is no longer being actively spread across the cartilage. Your muscles, especially the stabilizing ones around the knee, reduce their activity. Your nervous system shifts into a different state, one focused on rest and recovery, not movement and control. So when you wake up, your body is not in the same condition it was the day before. It is in a kind of low-activity state. Not damaged, not broken, but not fully ready either. Now here is where everything comes together. The moment you swing your legs off the bed and stand up, you introduce something your knee has not experienced for hours. Load. Your entire body weight. Transferred instantly through a joint that has not been warmed up, not been activated, not been prepared. The fluid is still thick. The muscles are still waking up. The cartilage has not yet been rehydrated through movement, so instead of smooth gliding, you get resistance. Instead of even pressure distribution, you get localized stress. Instead of controlled movement, you get stiffness. That is why those first few steps feel the worst. Because with each step, your body is trying to restart all of those systems at once. The fluid begins to move again. The muscles begin to activate. The joint slowly regains its natural rhythm. And that is also why, after a few minutes, many people say, "It feels better once I walk a bit." That is not a coincidence. That is your body catching up. But here is the problem. Every time you force your knee to handle full load before these systems are ready, you create small amounts of excess friction, small areas of increased pressure, tiny stresses on the cartilage and surrounding structures, not enough to cause immediate injury, but enough to matter when repeated over and over again, day after day, morning after morning. This is how something that feels temporary becomes something chronic, not because your body is failing, but because you are consistently asking it to perform at the wrong moment. And once you understand that, you stop seeing morning knee pain as something mysterious, and you start seeing it as something predictable, something mechanical, something you can actually change. Years ago, I had a patient, a man in his late 60s. He was not inactive. He walked every day. He tried to stay healthy, but every morning was the same story. He would wake up, sit on the edge of his bed, and just pause for a moment. Not because he was tired, but because he was preparing himself. He told me, "It's those first few steps, doctor. That's when it hits the hardest." A deep stiffness, a sharp discomfort, sometimes even a grinding sensation that made him hesitate before moving forward. And like many people, he had already made up his mind about what was happening. He said, "I guess this is just what happens when you get older." He had accepted it, not happily, but quietly, because no one had ever told him otherwise. When I examined him, I expected to find significant joint damage, severe arthritis, structural problems that would explain the level of discomfort he was describing. But what I found was surprisingly moderate. Yes, there were signs of aging, some wear, some degeneration, but nothing that should have caused that level of morning pain. So I asked him a simple question. "What do you do in the first minute after you wake up?" He looked at me a little confused. "I stand up and go to the bathroom," he said, like it was the most obvious thing in the world. And in a way, it was. Most everyone does. So instead of giving him medication, instead of recommending anything complex, I asked him to change just one thing, not his diet, not his exercise routine, just the way he started his morning. I showed him a simple sequence, movements he could do before his feet even touched the floor. At first, he didn't expect much, but a week later, he came back and said something I will never forget. It's still there, but it's different. 2 weeks later, he said, I don't dread getting out of bed anymore. And that was the moment it became clear. The problem wasn't just his knee. It was the timing of how he was using it. And this is where a small, almost invisible habit turns into a long-term problem. Because what happens next is not just a single moment of discomfort, it becomes a cycle. A very quiet cycle. That builds over time. You wake up in the morning, you stand up too quickly, your knee hurts. So naturally, you react. You become more careful, you move a little less, you avoid certain movements without even thinking about it. You might take shorter steps, walk a bit slower, sit down more often during the day, and at first, it feels like the right thing to do. It feels like you are protecting your knee. But here is what is actually happening underneath. The less you move, the weaker your muscles become, especially the quadriceps, the very muscle that is supposed to stabilize and protect your knee. And as that muscle weakens, your joint is forced to carry more and more of the load on its own, which leads to more stress, more pressure, more discomfort. So the next morning, when you stand up again, it hurts even more. Now the cycle tightens. Pain leads to less movement leads to weaker support. Weaker support leads to more joint stress, and more joint stress leads to more pain. Over time, this doesn't just affect your knees, it affects your confidence, the way you walk, the way you move through your day. And slowly, without realizing it, your world becomes a little smaller, not all at once. Begins with those first few seconds after you wake up. So instead of standing up immediately tomorrow morning, I want you to do something different. Before your feet even touch the ground, you are going to prepare your knee. Gently, gradually. The goal is simple. You are not forcing movement. You are waking the joint up. Think of it as giving your knee a few seconds to remember how to function again. Start by lying on your back, exactly as you wake up. Let your body stay relaxed. There is no rush. Now, focus on one leg. Slowly begin to slide your heel along the surface of the bed, pulling it toward your body. As your heel moves closer, your knee will begin to bend. Only go as far as it feels comfortable. No sharp pain, no forcing, just a smooth, controlled motion. And then, just as slowly, slide your heel back down until your leg is straight again. That's it. You are not stretching. You are not exercising. You are simply creating movement inside the joint. With each repetition, something important is happening. That thick, sluggish synovial fluid we talked about is beginning to move, to spread, to become more responsive again. You are, in a very real sense, warming the honey. Do this slowly, about 10 times on one leg, then switch to the other side. By the time you finish both legs, you may already notice something subtle. The stiffness is not as intense. The joint feels a little more awake. Now we add the second movement, and this one is even more important than it looks. Keep your legs straight on the bed. Relax your foot, and now gently press the back of your knee downward into the mattress. As you do this, you will feel the muscle on the front of your thigh tighten. That is your quadriceps, the muscle that protects your knee. Hold that gentle contraction for about 5 seconds, then release. Let the legs soften completely, and repeat, again and again, about 10 times. This movement does something very specific. It activates the muscle without moving the joint, which means there is no friction, no grinding, just pure, safe activation. You are telling your body, wake up, get ready, support this joint. And that changes everything. Now, when you eventually stand up, your knee is no longer unprepared. The fluid is moving, the muscle is engaged, the joint is supported, and those first steps, the ones that used to feel the worst, begin to feel different. Not perfect, not pain-free overnight, but smoother, more controlled, less shocking, And all of that happens before you even leave your bed. Once you've finished those movements on the bed, now you are ready for the next step. But not standing yet. This is where most people rush and undo everything they just did. Instead, I want you to move into a sitting position slowly. Swing your legs gently over the side of the bed and sit upright. Take a second here. Let your feet rest on the floor. But do not put your full weight on them yet. Your knees are already more prepared than before, but they are not fully ready. Now, from this seated position, we begin the next movement. Slowly lift one foot off the ground and begin to straighten your leg in front of you. Not fast, not with momentum, but controlled, steady, intentional. As your leg extends, you will feel the muscles in your thigh begin to engage again. That is exactly what we want. Hold your leg in that straightened position for about 3 seconds, just long enough to feel the muscle working. Then slowly lower your foot back down. Do not let it drop. Control the movement all the way down. That part matters more than most people realize, because when you lower your legs slowly, your muscles are learning how to control weight, not just lift it, but manage it, and that is exactly what your knee needs when you stand. Now repeat this movement about 10 times on one leg, then switch to the other. As you go through each repetition, something very important is happening. You are increasing the range of motion gently. You are continuing to circulate the fluid inside the joint. But most importantly, you are teaching your muscles to re-engage in a controlled way. Not suddenly, not under pressure, but gradually. And here is a small detail that makes a big difference. When your leg is fully extended at the top, give your thigh one extra gentle squeeze, just for a second, as if you are trying to pull your kneecap slightly upward. You may feel a deeper activation, a more focused contraction. That is a specific part of your quadriceps waking up, the part that helps stabilize your knee when you stand and walk. Over time, this becomes incredibly important because that small muscle is often one of the first to weaken with age and one of the most critical for knee stability. So by the time you finish this phase, your joint is moving, your muscles are active, your control is returning, and now, for the first time since you woke up, your body is actually preparing to handle your full weight, which means when you finally stand, you are no longer shocking your knee, you are supporting it. Now, you are finally ready to stand. But even here, there is a right way and a wrong way. Instead of pushing yourself up quickly, I want you to rise slowly. Use your hands if you need to. Give your body a second to adjust. And once you are standing, do not start walking immediately. This is the moment where most people lose all the preparation they just built. So pause. Just for a few seconds. Feel your weight through both legs. Let your knees settle. Now we begin the final phase. Place your hands lightly on a stable surface, a chair, a wall, or the edge of your bed. Bring your feet closer together. And bend your knees just slightly, not a deep bend, just enough to feel a soft flex. From here, begin making very small, slow circles with your knees. Move them gently to the right, forward, to the left, drawing a small circle on the floor with both knees together. Keep the movement shallow, smooth, controlled, no forcing. As you do this, you might notice something. A small clicking sound, a slight grinding sensation. This is where most people panic and stop. But here is something important to understand. That sound is not necessarily damage. It is often a sign that certain areas of the joint are still dry or slightly out of alignment. And this movement is helping to correct that. You are spreading the fluid evenly across the joint. You are allowing the surfaces inside your knee to reconnect smoothly. If you feel a spot where the movement catches or clicks, slow down even more. Stay gentle. Do not avoid it. Work through it carefully. Over time, those spots often become quieter, less noticeable. Do about 10 slow circles in one direction, then reverse and do 10 the other way. And now, we move to the final movement, the one that changes how your knee tracks when you walk. Stand with your back lightly against a wall. Take a small step forward with your feet about shoulder width apart. Now slowly slide your body down the wall, just a few inches. This is not a squat. It is a very shallow bend. Your knees should only bend slightly, no more than about 30 degrees. Hold that position, gently press your back into the wall. And now focus on your thighs, especially the inner part, just above your knee. You may feel a slight shaking, a deep burn. is the insight most people don't know. That muscle plays a key role in keeping your kneecap aligned when you move. When it is weak, the kneecap drifts slightly, and that creates uneven pressure and that familiar grinding sensation. But when it is active, it helps guide the joint smoothly into place. Hold this position for about 10 seconds, then slowly rise back up. Repeat it a few times, and now something has changed. Your joint is fully awake, your muscles are engaged, your movement is controlled. So when you take your first step now, it is no longer a shock to your knee, it is a continuation of preparation. And that is the difference between pain and support. So now, let's bring everything together. Because this is not about doing a lot, it's about doing the right things, in the right order, at the right time. Tomorrow morning, before you stand up, remember this simple sequence. First, stay in bed, slide your heel in and out, slowly, 10 times on each leg. Feel the joint begin to move. Feel the stiffness start to soften. Then, press the back of your knee gently into the bed. Hold it, release, repeat. Wake up the muscle that protects your joint. Next, sit up. Take your time. Extend one leg forward, hold, and lower it down slowly. Do it again and again. Build control, not speed. Then, stand. But don't rush. Pause. Let your body adjust. Make small circles with your knees. Smooth, gentle, like you are spreading something inside the joint, because you are. And finally, that small wall-supported bend, just a few inches. Hold it. Feel the muscle activate.
Moment,
let it do its
you're sitting
job.
on the edge of your bed,
it.
and you pause,
This entire
bracing
process
yourself before you
takes
even
about
try
a
to
minute,
stand up.
maybe 2.
You haven't moved an
but
inch,
what it
but
does
you already know
is
what's coming.
completely
It's a
change how
feeling
your
that,
knee
well, millions of
experiences
us
the
know.
first
That
steps
deep
of your
ache,
day.
that stiffness,
And there is
maybe
one
even a little
more
grinding
small
sound that
piece that
says, "Good
most
morning,
people
welcome
overlook.
to another day."
Before you walk away,
So what is going
drink
on
a
here?
glass of
You've
water.
been resting, right?
Because
Your
after
body's been
hours of
recharging,
sleep, your
but
body
knees,
is slightly
they
dehydrated.
feel like they've gone through
and
a
your
battle
joints
overnight. It just
need
doesn't seem
that
to make sense,
hydration
does
to
it?
function
Well,
properly.
let's pull back the curtain
So
and see
now,
what's really
instead of
happening
starting
inside
your
that
day
joint
by
while you
shocking
sleep.
your knee,
Okay,
you are
we
preparing
are going to
it,
get to the bottom of
supporting
this
it,
morning
working
pain
with your
mystery.
body instead
And I'll
of
give you a little
against it.
spoiler. It has almost
Now, you might
nothing
be
to do
wondering,
with that one
what
excuse
if my
we all
knees
love
don't
to
all
use.
feel the same?
And here it is, the big one, the
That's
trap
an
we all
important
fall
question.
into. We just
Because
shrug
not
and say,
every knee
I'm
needs
just getting
the
older.
exact same
But
approach.
you know what? That's where the
If
real
your
problem
discomfort
starts.
is mild,
Because that morning stiffness
just a bit of
isn't just some
stiffness in the
random
morning,
ache. It's a signal.
slight
It's a
hesitation in
big
those first
flashing
steps,
warning light from your knees
then you
saying,
can
hey,
follow this routine
something's not right
exactly
here.
as it is.
So here's the
Slow,
big misunderstanding we
controlled,
all have.
consistent.
We think we're hurting our knees
And over
when we're
time,
out walking or
you will
being
likely notice
active.
your mornings
But the truth
becoming
is, the most dangerous,
smoother,
high-risk moment
easier,
for your knee joint is in
more
those first
predictable.
few seconds
But
after
if
you
your
wake up,
knees feel
when
more
you force it to
sensitive,
take on your
if there
entire
is
body weight
noticeable
before it's
pain
even ready.
or a feeling of
So
tightness
why is your
that
knee
limits
so
your movement,
vulnerable first
then
thing in the
adjust.
morning?
Do
There's
the
this
same
fantastic
sequence,
analogy
but
that just
reduce
makes
the
it all
range.
click.
Do
Think of your
not
knee
bend
like a
as
car
far.
engine on a
Do not
freezing
push
cold
through
day.
discomfort.
Just jumping out of
Stay in
bed
a
is like
smaller,
turning the key and
safer zone.
immediately slamming the gas
And let
pedal
your
to
body
the floor.
adapt
You're
gradually.
demanding 100%
And if one knee
performance
feels
before the
worse
oil
than
has
the
had a
other,
chance to circulate.
always start with the better
So while you're
side.
sleeping, 3 key
Not
things are
because it
happening
needs more
inside your knee
work,
that create this
but
perfect
because
storm
it
of
helps your
vulnerability.
nervous system learn
First,
the movement
that natural
safely
joint fluid gets
before
thick.
applying it to the
Second,
more sensitive
the muscles
side.
that are supposed to
Now,
be your knee's
if your pain
personal
is more
bodyguards,
severe,
they're
or
totally
if you have
asleep.
been diagnosed
And
with
third,
conditions like
your
advanced
cartilage, the joint's
arthritis
cushion,
or a
is actually
meniscus
less
issue,
protected.
then go
Let's
even
dig into
slower.
each of
You may
these.
skip the standing
Okay,
circles.
let's talk about
or
that
keep
fluid.
them extremely
It's called
small.
synovial fluid.
Focus more
and its
on the
main
bed
job
and
is
sitting
to keep
phases.
things moving
Build
smoothly.
stability
But
first.
after 8 hours of just
Then
lying
add
still,
movement later.
it goes from a nice
Because this is
slick
not about
oil
forcing
to
your knee
something
to
more like,
perform.
well, cold
It is
honey.
about meeting
It's
your
thick,
body
it's
where
slow,
it is
and it's not
and
coating the
guiding
joint
it forward,
properly.
step by step.
And this just lays it all
Now,
out,
I
doesn't
want
it?
to be
On
very
the
clear
left,
with you.
that's your knee
This
when
is
the
not
alarm
a
goes off.
miracle. It
Thick
is not
fluid,
something that will
muscles
erase
offline,
years of
less
joint wear
protection.
overnight.
On the right,
And it is
that's
not
your knee
going to
after
make
you've been
all
moving
pain
around for a bit.
disappear after
It's
one
that
morning,
jarring
because your
transition from
knee
the
did not
cold
become
state
stiff in
to
a
the
single
warm
day,
state, where
and it
all
will
the
not
trouble
fully
happens if you
recover
rush
in a
it.
single day either.
And right here,
what this
this
does
is where a
is
really
different.
sneaky,
It changes the
dangerous
pattern.
cycle kicks in.
If you do this
It's
once,
simple.
you may
You
feel a
wake
small
up,
difference.
stand too fast,
Smoother
and your
movement,
knee
less
screams
shock
at
in
you.
those first
So
steps.
what's your natural
But
instinct?
if you stop
You
there,
try to protect
the old
it.
pattern
You start to move a
returns.
little less, take it a little easier during
However,
the day.
if you repeat this
But here's the
day
paradox.
after day,
As you move
something
less
begins
to
to
protect
shift.
the joint,
Within the
the
first
most
week,
important muscles
many
that
people
support
notice
your
that
knee,
the
we're
stiffness
talking about your
doesn't
quads
last as
mostly,
long. Within
start
2
to get
weeks,
weaker.
those
So
first
while you
steps
think you're
feel
helping,
more controlled,
you're actually
less
dismantling your
painful.
knee's natural support
And over
structure.
time, the fear
And
of
that's
getting
how
out
the
of bed
cycle
begins to
completes
fade.
itself.
That is when
Now
you
that your
know
muscles
something
are
is
weaker,
working.
your
Not
knee
because
joint
everything
has
is
to
perfect,
take on even more
but
of the
because
load,
it is improving.
more of the stress,
And
all
that
by
matters.
itself. And what does that lead
Because
to?
real
You guessed
change
it.
in the body
Even more
is
pain
not
and
dramatic.
stiffness the next
It
morning.
is consistent.
And the whole thing just
It
gets
is
worse
quiet.
and worse.
It builds slowly.
So,
until
the big
one day
question is,
you realize
how do we break
what
this
used
cycle?
to feel difficult
Well, the solution
now
is
feels
actually
normal
pretty
again.
simple.
There
And
is
it all
something
starts
very
before your
quiet
feet even think
about
about
the way
touching
our
the floor.
bodies change
Let's
over
walk
time.
through a gentle routine
It doesn't happen
that
all at
basically
once.
prepares your knee for the day ahead.
There is no
All
single
right,
moment
phase
where
one.
everything
You're still lying
suddenly
in
feels
bed.
different.
First,
Instead,
heel slides.
it
Just
shows
lie on
up
your
in
back
small
and
ways.
slowly, gently
The way you
slide
pause
your heel
before
up towards
standing.
your butt
The
and
way
back
you
down.
think twice
What
before
you're doing
taking
here
that
is
first
basically
step.
stirring that cold honey
The
we
way you
talked
begin
about.
to notice
You're warming up
things
the synovial
that you
fluid
never used
and
to
getting
think
it to
about.
flow into all the
And
nooks
little
and
by
crannies
little,
of the joint.
those small
Next,
adjustments
quad sets.
start to
You just
shape
tighten
your
your
day.
thigh muscle and press
You
the back
move
of your
a bit
knee
more
down into the
carefully.
mattress.
You sit
This
a
is like
little
flicking on
longer
a
than you
switch and
used
telling
to.
your knee's main
You
support
become more
muscle,
aware
hey, wake up.
of every
We're going to need you in a
movement.
minute.
Not because you
Okay,
want to,
now for phase two.
but because your
You've sat
body
up
is
on the edge of the
asking you
bed.
to.
Do
And
some
over
seated leg
time,
extensions. The key
something
here
else
isn't just
happens.
lifting the leg.
You
It's about
begin to
controlling it
accept it.
slowly on the way back down.
Not as a problem,
That builds stability.
but as something
Then,
normal.
once you're standing,
something
holding
that
on to
comes
something,
with age.
do some small,
something
gentle
you
knee
stop
circles.
questioning.
This just helps to
But
spread
here
that
is the
newly
truth.
warmed lubricant all over
Not
the
every
joint
change you
surfaces.
feel
Finally,
is something
a little
you have
wall
to
support
surrender
event.
to.
You're just
Sometimes
activating all those smaller
it is simply
stabilizing
something
muscles,
you have not
making
been
sure the
shown
whole
how
team
to
is awake
manage
and ready
because
before
your body
you take
is
that
not
very first
working
step.
against you.
And you want to know the best
It
part
is
of all this?
responding,
The whole thing
adapting,
takes what? Maybe a
trying to
minute,
protect
60
itself
seconds? It's not
in
a
the
huge
only
workout.
way
It's
it
just a
knows
smart,
how.
simple sequence
And when
to
you give it
completely
just a
change
little
how your
support,
knee starts the day.
a little preparation,
So really,
a
this
little
is about
time to
more
adjust,
than just avoiding
it responds
pain.
differently.
It's about
It moves
fundamentally
differently.
changing
You
your
move
relationship
differently.
with that first
And
step
those
of the
moments,
day,
the ones
turning
that
it from
used to
something you
feel
dread
uncertain,
into something
begin
you
to
control.
feel steady again. Not
When you think
perfect,
about it,
not
it all
like you were
boils
20
down to
years
this
old,
simple choice
but
every
stable,
single morning.
reliable.
On the left,
Yours.
you've got the old way.
And that
Shocking
first
a
step
cold,
in the morning,
unprepared
the one you
joint
used
into
to brace
action.
yourself for,
And on the right,
becomes
you have
just
the new
another
way.
step,
Investing
quiet,
just 1 minute
natural,
to warm it up,
unremarkable.
lubricate it, and
The
support
way
it.
it was always
And
meant
this
to
quote
be.
from a patient
So tomorrow
really
morning,
says everything. After
don't
just
do
2
what you
weeks
have
of doing
always
this
done.
tiny routine,
Don't rush
that
out of
dread
bed.
was
Don't
gone.
let that first
It
step
turns
be a
out
shock
the
to your
problem
body.
wasn't just his
Take
knee.
1 minute,
It was
just
how
one.
and when he was asking
Follow the
it to
sequence
work.
you've seen here.
Now, it's
slowly,
so important to remember
calmly,
this isn't
without
some
forcing
overnight
anything.
miracle cure.
And then notice
it's
the
all
difference.
about consistency.
Not in theory,
Your knee
not
didn't
in
get
what
this
someone
way in
told
one
you,
day, and it's
but
not
in
going
how
to feel
your own
perfect
body
in one day.
responds.
But by
And if this
consistently
helped
changing
you
that morning pattern
even
day
a
after
little,
day, you give your
think
body
about
a chance
someone
to heal.
else who might be going
and that
through
leaves
the
us
same
with
thing.
one final thought.
A parent,
Instead of waking
a
up
partner,
and bracing for that pain,
a friend who
what
has
if you could
quietly
take that first
accepted
step
that
with
morning pain
confidence?
as normal.
What would that feel like?
Share this with them.
By taking just
because
1 minute,
sometimes
you can
the
change not just
smallest
your morning,
change in a
but maybe how
routine
you move through your entire
can make
day.
the biggest difference in how someone lives their day.